introduce you, then we have a few more in now. So everyone, it's my pleasure to introduce Dr. Fleur Leenen. She is an epigenetics specialist and statistician with over a decade of experience in applied data analytics, both in the academic as well as the industrial environment. She holds a PhD in computational biology and bioinformatics from the Luxembourg Institute of Health and 2 master's degrees in molecular biology from the Catholic University of Leuven, and then a statistical data analysis master's from the University of Ghent in Belgium. Dr. Leenen joined BISC Global as one of the first 3 employees in the US division and is tasked with launching the formation of the company's new department in Boston. And after doing that and establishing a profitable entity on the East Coast, she's now moved over to join us on the West Coast, where she currently manages the newly formed department in the San Francisco Bay Area. She's here today to talk to us about data-driven workflow optimization, gaining insights, reducing lead time, and cutting costs, and with 2 case studies. I will turn it over to you, Fleur.
Thank you for this kind introduction. I'm sharing my screen. Can everybody see this?
Yes, we can.
Okay, great. And with that, I will kick off my presentation. So I'm Fleur Leenen, and I will be talking about how data-driven workflow optimization can not only help you gain insights in the science underlaying your research, but also help you reduce lead time and cutting costs. I will start with a brief introduction to my company, BISC Global, following that up with 2 case studies, one regarding antibody lead optimization and one regarding the development of a biomarker panel to improve prostate cancer diagnosis. And I will then summarize this in the end conclusion, at the end of the presentation. So, as mentioned, I work with BISC Global, which is a fairly young company that was founded in 2017 and has since then been selected as one of the top 10 bioinformatics consultant and services firms by the CIO Application magazine in 2020. We have offices in Belgium, Switzerland in the EU, and in Boston and San Francisco in the US, and are still expanding. The majority of our service centers really around data analytics, custom tools and pipeline development, and cloud solutions that can be delivered either on-site or remotely. Although currently with the pandemic, obviously remotely is the way to go. And with that, I would actually like to shift to the first case study. The first case study is focusing on antibody lead optimization in collaboration with Ligand Pharmaceuticals site located in Emeryville, California. So let me sketch you a bit of the background. Currently, state-of-the-art antibody discovery platforms primarily use 2 different technologies to generate lead candidates. Either they use phage display or they use animal vaccination. In this case study, we'll be focusing on the animal vaccination approach, where technically you're leveraging the animal's natural immune system's response to generate fully affinity matured antibodies against the target. You do so by exposing the animal to a standardized immunization protocol, which makes then that the animal's immune system will start selecting and multiply B cells that produce targets against specific antibodies and also improves them in that process. Now, depending on the animal, you'll have between 1 million to 1 billion of different B cells, and only a fraction of those will actually present the receptor of interest. And so it's really important that you'll enrich for that particular receptor. Doing so, you do by exposing them to a repeated vaccination approach and harvesting during the peak response to really maximize your chance of selecting the promising candidates. At the moment of harvest, normally you'll be retrieving between 100 to 1,000 B cells, and you'll then characterize and select for those expressing the receptors of interest, which are called lead candidates. Those lead candidates are further characterized and are subject to post-discovery modifications such as immunogenicity reduction, isotope modification, etc. All important characteristics to consider for the downstream path and ultimately before entering clinical trial. As we know that a clinical trial can increase the cost 10 to 100-fold compared to the initial discovery, it's really essential that you move into the clinical trial with only the best possible candidates to ensure to maximize the chances of success. And so our hypothesis is that due to the stochasticity of the picking process of these 100 and 1,000 of candidates during the primary discovery step, it's really not unlikely that you'll be missing out on the best candidates. And so rather than just focusing on the single cell screening and sequencing for lead identification, we think that by integrating the information that you can get from next generation sequencing applied to the B cell repertoire, you can actually select variants of those initial lead sequences with improved properties, such as for affinity, reduced sequence liability, improved expression, etc. Our algorithm allows to do that, and normally you would do that within the same animal as that you generated the original lead from, but obviously you can also apply that to the same species vaccinated against the same target. And so, having this hypothesis in mind, we obviously wanted to do a proof of concept in collaboration with Ligand. And our goal was to show using that NGS data in this optimized data-driven workflow could select improved versions of the current lead candidate. In order to do so, we started off with the Omni chicken, which is a transgenic humanized chicken. And from that chicken, we obtained 3 fully characterized lead candidates, C5, E1, and H2 against the target progranulin. For the NGS side, we extracted PBMCs that were then subjected to a targeted VH and VL amplicon sequencing to gain the necessary next generation sequencing information. From the data analytics perspective, the next generation sequencing data was then processed through our standard immune repertoire pipeline into a standardized AirTSV format, which is a standardized immune repertoire data format developed and released by the AIR community of the Antibody Society, if you would like more information regarding that. And that output is then fed into our proprietary algorithm to select for candidates with improved characteristics, such as increased expression rates, thermostability, and thermostability. And the output of that comes in a format of a 96-well plate, where a combination of 12 heavy chain and 8 light chain sequences, including the parentals, are ready for experimental verification. Experimental verification follows up with looking for the expression of all of these combinations, looks at the binding conformation through ELISAs, and with the LSA method of Cartera, we look into the kinetics and the epitope binning itself. Now, having a quick look at the data analytics part, when we start with the 3 fully characterized lead candidates, and we have FASTQ files, each containing about 2 million raw sequences. That's a lot of sequences, and we want to actually get down to the point where we can, from the raw sequences, go to an alignment where we can distinguish between single, double, and triple amino acid point mutations within the 6 CDRs of the original clone, as the example in the top image here shows. Once you've done that, on top of that, we want to select for indicators of improved properties of interest. Technically speaking, what we're going to do is we're looking at the whole VH repertoire, which is approximately 5,000 clusters, and we will narrow it down by reducing it to the top clusters of interest for us specifically, as you can see on the side. The same, of course, is done for the light chain. And at that point, you can either continue working with the top clusters of interest and thus sequences of interest, or you can repeat the whole process going again back to the next generation sequencing data and refine or focus even more into certain sequences or clusters of interest. Now, this is the data analysis part. Of course, not all of these heavy chain and light chain combinations will lead to antibodies that can actually be expressed. And so some experimental validation or testing is still warranted. And one such an example of an output is shown here, where the Cartera LSA output for 96 variants of the starting clone shows that indeed there are quite a couple that don't express, as you can see here in the gray tiles. Some have poor affinity, as the one in the yellow tile, but there's still quite some variants out there that are quite promising. And so if we look at all these different characteristics, in the end, we find that we were able to find improved variance for all three candidates, whether it's for affinity or for binding conformation or other characteristics of interest, as you can see here in the table. Now, as you more specifically look at the graph, you will see that for each parental clone that is indicated in red on these graphs, there are really improved candidates, which are in the upper left quadrant, here circled by a purple square. And they show that each of them have actually improved affinity, especially the E1 clone, where we see that the affinity is improved from 138 picomolar to actually 18 picomolar affinity, which is really an incredible increase in affinity. And so overall, what we see is that we were able, for all three of these clones, to find improved variants to work further with. And so combining next generation sequencing with the standard single cell screening approach really does pay off. So summarizing all of that, when employing animal vaccination approach, irrespective of the animal transgenic or not, integrating the information from the single cell screening and sequencing with the bulk repertoire sequencing information really leads to an expansion and identification of improved candidates. Not only are you gaining scientific insights in your antibodies, but also the output of this, what we call clone refinement tool, ultimately ensures that you move into clinical trials with only the very best antibodies, significantly reducing the risk of failure, dropouts, and additional refinements, and thus overall experimental costs and time. In this particular case study, we were actually able to improve all three lead candidates, including reaching double digits picomolar affinity for one of them. And so on a side note, part of this process is now available on the online pipeline platform OP² by BISC, but I'll give more information about that at the end of this talk. And so with that, I would like to switch to the second case study, where we will be focusing on the development of a novel multi-source biomarker panel for prostate cancer using semen as a testing source. This was conducted in collaboration with Greger Diagnostics, a molecular diagnostics company located in Wisconsin. So let me sketch you the background of this project. Currently, the standard care for prostate cancer is screening the blood for prostate antigen. And when the level of that prostate antigen is above a certain threshold, you have to follow up with either an ultrasound or a biopsy. Now, the issue with that is that even though quite some people show an elevated PSA level, the biopsies are still like for 55% negative, not only potentially causing after effects of the biopsy, such as bleeding, infection, urinary retention, and also potential additional costs for the health system. So there is really room for improvement for a screening approach that is more reliable and that has a higher outcome that has a higher confidence, really. And that's where Greger Diagnostics come in. They are working on such a method by applying a heterogeneous biomarker panel to semen samples. The workflow that they have in mind encompasses a variety of assays. They are using the ELISAs for quantifying the AMA or CR protein levels. They are using antibody stain flow cytometry to characterize microparticle quantities and surface markers, and are also profiling the DNA methylation profile to specific PCRs. All of that information is then captured in particular computer algorithms towards a yes/no response of the cancer state with a high sensitivity and specificity. An initial dive in the data with 4 cohorts, one with a PSA level below the threshold and 3 above the threshold. Initial exploration of that data showed that whether we include all the samples or only those with a high PSA, actually, in both cases, the diagnostic panel from Greger already had a higher sensitivity to what the current approach actually shows. And so the first indication that this diagnostic panel could be quite promising towards the future. So with that in mind, we have the whole background of the project. And so where does BISC come in? Well, we have already the first data, we have the first insights. So where we come in is reviewing the current statistical approach and looking whether we can actually optimize that approach or whether we would apply a new statistical method. In this particular case, we have actually opted to apply a new method. This will be a machine learning method that is based on adaptive artificial neural network, encompassing components such as feature importance analysis, uncertainty analysis, and quantifications towards a high specificity and sensitivity overall. Part of our approaches as well is to help with experimental design and the power calculations for future studies and for grant applications to support this development. So currently, the idea is that rather focusing on the initial regression model, we want to switch to a machine learning-based model. Why? When we looked at the initial data, we see that even in a limited amount of data, there is a highly complex nonlinear relationship between the data points. And so this regression model just doesn't capture that complexity and probably will also not be able to handle this adequately towards the future when more data comes in. Hence, where we want to use a machine learning model to better integrate the multiple heterogeneous biomarkers and predict the cancer versus non-cancer state in a more appropriate way. An important aspect of that is the feature importance analysis to ensure that we capture all the key biomarkers and their interactions as part of the input layer for the model, but also that it provides us additional information regarding the importance of each marker and how these might be impacted across different cases. So as you see here, you have the biomarkers at the input layer through a hidden layer that is based on artificial neural network to an output layer for yes or no regarding the state of the cancer. And in this particular case, as I mentioned, we decide to go for an artificial adaptive neural network approach for the defined biomarker set. Main reason being that we know that this approach is actually highly efficient at tackling highly complex nonlinear problems that come to a yes-no decision in the output layer, which is often encountered in medical processes such as diagnostic workflows, and is definitely the case here. Additionally, this is an efficient algorithm to process large and complex data quantities. And whereas our data currently is not that large yet, we do know that there will be a steady influx of data, and we want a model that can function not just now, but can also function efficiently later on. And so this dynamic and flexible aspect of the adaptive artificial neural network is really attractive to solve our prediction problem. And so, of course, when we are applying these artificial neural networks, there are also a couple of drawbacks. We know that it is impacted by multitude of parameters, such as the number of neurons, number of iterations. We also know that it is susceptible to the test size that we are working in. As you can see here, when we're using a test size of 15%, both sensitivity and specificity are relatively high, above 90%. Now, when we're working with a test size of 20%, this is not the case anymore. One of them drops dramatically. And so, of course, with new data coming in, we are confident that that both of them will increase again and will be more, in general, we'll have a more robust model. But at the same time, when developing this model, we want to be sure that we can really capture the data noise and partially the incompleteness that you have when you're extracting reduced dimensional manifolds from higher dimensional data sets. And to do that, we actually apply an uncertainty analysis and quantifications that we can inform of the uncertainties in the learned models, ultimately making sure that we have an approach that converges the machine learning-based models with model-based predictions, so that all numerical and experimental data can help self-inform these predictions and allow for effective building of this uncertainty analysis into cognitive computing with a high sensitivity and specificity of the prediction at the end. So recapturing where we currently are, Gregor Diagnostics has a diverse panel of biomarkers across different fields, and it already just in a first test shows that there's a great sensitivity improvement from 18% to 79%. Currently, we're at the stage where we are developing a machine learning approach that later will converge the machine learning-based models with the model-based predictions. Towards the future, we anticipate that the increasing amount of data will increase the confidence in these prediction results even more. Now we will have a sensitivity and specificity nearing actually more 100% even, so that ultimately this model will not be just an aid in diagnosis, but will be more of a diagnosis tool in its own right. That would be the ultimate goal. So overall, I've presented you now 2 case studies showing the benefits of data analytics. A first one indicating how you can, by integrating information from next generation sequencing and antibody leads of interest, really optimize the final candidates, ensuring that when you move to those clinical trials, you're working with the very best antibodies, reducing the risks of failures and other aspects, and in general, reducing the experimental costs and time. Case study 2 indicate how an optimized data analysis approach was better at capturing new insights in the data, but at the same time, by developing already the approach parallel with the data influx, actually having a positive impact on the actual timeline towards developing a diagnostic biomarker panel that we can be confident in. And so these are 2 particular case studies with 2 particular case studies in different fields, but obviously the idea or these approaches can be conducted across a myriad of fields of interest. And BISC Global's team is really happy to assist you with that. If you have data you just want to run through a standardized workflow and don't want to be bothered by the infrastructure or with command line, I recommend you the online pipeline platform that is powered by BISC Global OP², where you can put your data, load up your data yourself, and after it's run through the pipeline, play around with your data and the visualizations. Now, if you feel that the flavor that you need, the workflow that you're looking for is not there, or that in order to attain your goal, you have need for a more custom tailored approach, you can find more information on our website, BISC Global's website here mentioned, but you can also contact me directly on my email address, fleur.leenen@biscglobal.com. And with that, I'm finishing my presentation. Thank you for your attention.
Well, thank you again, Fleur, for your insightful presentation. And I will open the room for any questions for Ms. Fleur Leenen.
So yes, Fleur, thank you very much. It was a very interesting presentation, 2 very different topics to discuss. And I have a question for both as well as a comment. So if we take your first case study, you mentioned that you saw improved affinity in several candidates. My question is, and you mentioned that you were looking for multiple different traits potentially. So did you see any candidates that demonstrated an improvement or the desired values in more than one trait?
Yes, we did. I cannot really share that information as it is proprietary, but we did. On the other hand, I must say that we're also still fine-tuning specifically for specific characteristics of interest. But so the overall answer is yes.
Okay, great. And then with case study 2, I mean, I obviously very much support the idea of, trying to find a less invasive way, a less invasive biomarker to measure disease. And I think obviously the use of semen definitely far outweighs doing a biopsy. My question is with regards to the AI ML workflow in that network. You mentioned that it's geared towards finding a yes/no answer, which is very arbitrary, obviously. But my question is there ever a maybe from the data?
Yeah, this is obviously, you want to have a binary response. Let's put it that way. But we are aware that no matter when you're working with data, there is no such thing as a perfect yes or no. There is always some incompleteness, some variability. And so that's why we're really aiming to have that sensitivity and specificity above 90%. But there is always, even if you're there, you're still at a 10%, 5%. Maybe it was not the correct answer. And so we're actually gearing to get towards that 100% by really having more data coming in and making sure that our approach is more robust so that we can really minimalize that this maybe factor. But obviously that is work in progress as well.
Right. Thank you very much.
Wonderful. Thank you again for your great presentation. And I guess we will be heading to our next presentation from Bayer. Mr. Vanja will be speaking about wearables and biosensors. So let's all head over to that.